There's certain diagnoses like you are not. It doesn't matter how healthy you are, how much you eat right and exercise and sleep well and do all the things, medicine is going to be part of your life for the rest of your life.
Mm.
All the other ones, medicine is a tool to be used.
Okay.
And the hard part is it's easy to overuse and it's easy to underuse.
Mm.
So I ask very direct questions of, are you going to sleep? Are you waking up? Do you get things done during the day? Do you make it to work? Do you care for your kids? Do you get the dishes done? What were you not getting done before that you're getting done now?
Mm.
How do you feel while you're doing it? Because I care about what they're doing and how they feel about it.
Okay.
Because some people can still get a whole lot done and they're massively depressed.
Yeah.
Other people feel fine and they're doing nothing.
Yeah. It's a big balance.
I'm just trying to get those two together. We're recording.
Yes. Matthew Larsen, welcome to the podcast.
Thank you.
This is a new season. So which title are we going to do?
Well, the running title is Be Bored.
Okay. Yes. We will do a long episode on Be Bored. So let's do that. But I also want to do an episode on Be Medicated.
Okay. Which one do you want to do right now?
Let's do first because you have a time constraint. So, Be Medicated.
Okay.
Tell us who you are.
I'm Dr. Matt Larsen. I'm a child and adolescent psychiatrist.
Kind of a big deal. Actually, you're like a bigger deal than that because there's more to you than...
I do many things. So if I'm trying to give all my credentials, I'm double board certified, general psychiatry, child psychiatry. I was the medical staff president at the big hospital in town for the last 2 years. I'm still the credentialing president. I own my own business. I run a residency training program for doctors who want to become psychiatrists. I speak at multiple universities.
You just spoke at the Capitol.
I just spoke at the Capitol. They needed me to testify before the Joint Finance and Appropriation Committee.
Yes, that's awesome. And we're going to do a big event on Be Bored.
Yes.
We're going to have you speak on that. It's our More Social, Less Media event that's happening in September.
Yes.
But let's talk, before we talk about being bored, about being medicated.
Yes.
So what do you have to say about that?
Okay. So the way I see medications, very much they are a tool. They are something that is useful, something that is helpful, and we have to choose if we're going to use it. There are few people in the world that have to have medicine to survive.
Which we actually got one of those diagnoses.
Right. You do.
Yeah.
When you have type 1 diabetes, there is no option.
Yeah. And there's a lot of people that tell us about other options, like elderberries can fix it, or cinnamon or paprika, and like all of these things. So I will say, I get real kind of like testy when people are like, oh, let me tell you the natural way to do things.
Right. Because I'm all about natural ways. Because, every medicine we have came from somewhere in nature.
Yeah.
We purified something or found something that worked or took it out of the human body or animal or plant and purified, changed it so it would help us.
I've actually never really thought that. That's actually true.
Every medication in the world is natural because otherwise where'd we get the ingredients?
Yeah. Like we don't have any alien medications yet.
Right. So other than the diagnoses that require medication, absolutely, you will die without it. There is no other option.
Which is really only a handful.
That's only a handful. That's diabetes. And there's really only a few mental health diagnoses that the chance of you are doing well without medicine is almost none. That's schizophrenia.
Okay.
There's certain diagnoses like you are not. It doesn't matter how healthy you are, how much you eat right and exercise and sleep well and do all the things, medicine is going to be part of your life for the rest of your life.
Mm.
All the other ones, medicine is a tool to be used.
Okay.
And the hard part is it's easy to overuse and it's easy to underuse.
Mm.
And so you really have to figure it out because some people just have a mental block with medication. I don't take meds. I don't want to. I refuse to, etc.
Yeah.
When someone comes to my office, I know that at least they've already thought of it. Okay. They wouldn't be in a medical doctor's office unless they'd at least considered I may be offering them medication.
Okay.
That could be the answer.
Okay.
So the best analogy I've come up with for medicines is comparing them to shoes.
Oh, and I actually love this.
So, and I've used this with a lot of patients because it works, because it connects. Because we all wear shoes pretty much all day, every day, at least in the United States. And the only foreign countries I've been to, they also wear shoes all day.
Yeah. Unless you're like hanging out in the yard.
Right. Yard, house. But when we go out, we're pretty much in shoes.
Yeah.
And then I point out, well, I'll run it with you. Do we need shoes to survive?
Yes. No.
Agree that you would die if I took them away?
Yeah, no, but
Right.
I could be barefoot.
You can be barefoot. Now, we don't have to have shoes to survive. You'd be okay without it.
Yeah.
Are shoes a natural part of your body or your day, or is it unnatural and it's something we added?
It is not natural. I have to put them on.
Right.
They were invented.
Right. They don't appear anywhere naturally in nature.
Yeah. Which actually, that Super Bowl commercial with the hat, like,
It was weird.
so
With the skin hat.
Yes.
Awkward.
Yeah.
Yes.
Gross. That's not what shoes are, right?
No. So, also, do shoes keep you a little bit weak? Do they make your feet a little soft?
Yeah.
You don't build up calluses. You don't get the same skills or abilities you would if you wore bare feet all the time.
Right.
So, shoes aren't natural.
Which depends on the time of the season too, because like when I'm in flip flops, I get calluses.
Right.
Or like they look a little rough. My
Right.
feet look a little rough. When like winter, they're in socks and boots all the time.
Right, because flip-flops are closer to barefoot.
Yeah. Yeah. That makes sense.
Yeah.
Yeah.
So, we don't need shoes to survive. They're not natural. They make our feet a little bit weak and soft. They keep us from developing calluses and strengthening up. And yet, we all wear them all day, every day.
Well, not all day, but
But the reason is obvious. And sports is the easiest place to notice it.
okay.
Watch the greatest basketball stars. Currently, like LeBron James and others, I'm sure. Steph Curry, I'm not sure who's of the moment. But best basketball star in the world, take away their shoes. They're still going to be far better than me. They're going to be, I could wear the best shoes and they could wear none and they're still going to win.
They'd still barefoot and would beat you.
Right. Same with soccer.
Okay.
Take away the cleats. They will still be better than me. I grant that. However, they're not going to be nearly as impressive. Their muscles are the same. Their strength is the same. Their abilities, agility, intelligence, knowledge of the game, it's all the same, but they can't produce on the field because they're not wearing the right tool on their foot.
Interesting. Okay.
And that's medications.
Okay.
For most people, medications are not necessary for survival.
Yeah.
They're not natural. And they actually keep us a little bit soft and a little bit from developing the skills to work through the depression, work through the anxiety, work through the thing. I grant all of that is true. Why do we use them? Because it makes our knowledge and strength and skills and abilities visible and usable on the field, on the court, in life.
In the classroom.
In the classroom. Kids with ADHD, stimulants don't make you smarter. They just get your intelligence on the page.
Yeah. Yeah. So let's talk about ADHD meds, especially because this is a Joyrific podcast, especially related with emotional intelligence and things like that. Give us all of your knowledge on that.
Right? Because a lot of people use ADHD meds just for school, and that's fine. But when you can focus and concentrate, your emotional intelligence goes up. I've seen people that were treated for anxiety or depression for years finally get on an ADHD medication and they were able to stop their antidepressant. Because the reason they were depressed or anxious is because they couldn't focus. They couldn't organize their thoughts and do something useful with it. They had all these genius thoughts, but they were jumbled and they didn't go any direction. It's kind of like having a whole bunch of gunpowder and just setting it on concrete and letting it on fire. And it just fizzles.
I've never done that.
Whereas if you put it in a steel tube with a cone on the top, and fins on the bottom, all of a sudden you have a rocket that can fly and can be amazing, can do these things because all your energy and force is going one direction. It's focused.
I like that. So I think that there's kind of two parts that I want to discuss with anybody that's listening. So there's the part of be medicated, which I have some of the type 1. I'm over this idea of like meds doesn't work because it does work for her.
Yes.
Right? And now we're getting into more ADHD stuff as well. But then there's this other side of once you have gotten a diagnosis and you're taking the meds and it's not working or like things are hard, like what do you do then? How do you address that? How do you fix that? Because you're the expert and I have your undivided attention.
It's kind of like going to the school teacher or the car mechanic.
Okay.
The goal of the car mechanic is to get your car functioning well for you and all the things you use it for.
Okay.
If you're not going off-roading, they're not going to give you the stuff to go off-roading.
Okay.
School teachers, the same. They want to get you functioning, the student functioning as well as possible. If your doctor, your PA, your nurse practitioner, your prescriber, whoever is working well with you, they want to get you functioning well. They don't care if it's with meds, without meds, less meds. Well, they don't really care. They probably want less meds because we always want less.
Yeah.
So if you're doing well, go talk to your doctor, because some people do get better because they have a better relationship and they're sleeping better. They're spending less time on their phone. They're doing healthy things and they improved and they don't need meds anymore.
They changed their lifestyle.
They change their lifestyle because that will fix a lot.
Yeah.
There are people who they took the med, they're taking it still, and they still don't feel good.
Yeah.
That's when you have the conversation. Like, okay, it's kind of like when people can't sleep. I'm probably irritating people with it, but I always go back to sleep hygiene first. Like, before we talk about trazodone and Ambien and Doxepin and amitriptyline and all these things, let's talk about putting the screen away an hour before bed, keeping the room cool, heavy blanket. Don't make your body hot before you go to bed. Don't exercise right before bed. There's all these well-researched things we can do to sleep better. So it's always balancing all the things you can do environmentally and in your life for a healthy lifestyle. And then if that's not enough and you still can't function well, we add medication to it.
So what if your mother-in-law or your mother, which whatever it is, says like, oh, don't ever go to, they would never say that about Matt, but don't go to a doctor that's going to prescribe. Like, how do you approach that conversation or help like turn that around?
You try to thank them for their concern and see what part of their advice is useful.
Okay.
Because they're probably coming from a place of love and care and trust. They wouldn't tell you anything. If they didn't love you or care about you, they'd just say, do whatever you want.
Yeah, I don't care.
So
Okay.
they already have some compassion for you because they may have had a bad experience. They may have taken a bad med. They may have gone to a doctor who didn't listen, gave them something that was completely incorrect, didn't warn them about side effects. So they may have had a bad experience. They're trying to tell you don't do the same thing. It's like your parents are telling you, don't touch the stove. Well, if you're still not touching the stove when you're 16 and 20 and 30, well, you need to learn to cook.
It's time to touch
the stove. Don't touch the car keys. Don't drive the car until it's time to drive the car.
Yeah. Yeah.
And so you take everything with knowledge of they're probably coming from a place where they got hurt, or someone they love got hurt, and they don't want to see you get hurt.
Okay.
And so you try to validate exactly how they're feeling or why they're telling you that, and saying, thanks, I will keep all that in mind while I go. And you also take the doctor with a grain of salt, because not every doctor is on their best game that day.
Yeah.
And not all prescribers get it right.
Yeah. And tell us more. Let's go specific with ADHD, because I know that, that's what I focus on in my life. But so with ADHD, it's not just one and done.
Right. There are multiple stimulants. Basically, well, there's two stimulants we prescribe, methylphenidate and amphetamine, and there's like 15 versions of each.
Okay.
Then there's the alpha agonists. Those are kind of like blood pressure pills, clonidine, guanfacine, Intuitive. Then there's non-stimulants, Strattera, atomoxetine. And then there's a few others like Wellbutrin that can do some. So there's multiple classes that can treat ADHD. And really you're looking for what works for your life, because some kids do amazing on a stimulant as far as focus, but they're already thin and it kills their appetite. And then they're losing too much weight and it's dangerous. It's like you need calories more than you need focus. So let's get your body healthy and see if we can find a different answer.
So a parent or maybe a mom or that's going through this for the first time, that's experienced this for the first time, what's your best advice for them as they begin this journey and continue on the journey?
It would be ask advice from people you know care about your child, but how their child acts moment to moment doesn't change that person's life.
Okay, explain that.
So, okay, maybe this is too far of a tangent, but when you're working with alcoholics, you want to have their sponsor be someone that does not live with them and is not involved in their lives.
Their sponsor, okay.
Because they need to be able to give them advice, whether they fall or not. Doesn't change their day, didn't screw up the birthday party, they can still sleep fine, eat fine,
okay.
They will give great advice and it has no influence on them or their life. Because the spouse
is too close.
It's too close. Everything their spouse chooses will influence their life.
Okay.
So talk to people who care about your kid, but if they don't do well in school, doesn't hurt them none. The grandparent. Somebody at the school who's not their direct teacher, who's not being checked on for them. Someone at church someone at the T-ball who cares greatly about your child, and they love you and they love them, but if they didn't improve, their life's fine.
That's interesting.
Those are the people who usually give us the best advice, because they'll tell you, yeah, your kid doesn't focus very well. Yeah, they're a bit of a pill.
Yeah.
Oh yeah, they get totally, they wander off, they're not paying attention. Because they can just tell you what's going on, and they don't feel so close to the situation that they have to handle it with kid gloves.
Okay.
But they care enough to tell you.
Like someone at Taco Tuesday.
Right. So that's who I go to, is those kind of folks to say, okay, what do I do with this situation, with this?
Yeah.
So when you're wondering about ADHD and medications, yes, get information from, absolutely talk to your spouse. Yeah, very important. Talk to those people, but also get some advice from people outside that circle. Because you want to hear people who loved medications and people who had a terrible time on them.
Yeah.
And people who they were mediocre. And people who they were a little bad.
Yeah.
Hopefully your doctor has seen all of that and heard all of that, listened to all that. And when they talk to you, they ask you all the questions. What's your biggest concern? Because some people's biggest concern is, I don't want the medication to make me a zombie.
Yeah.
Great. We won't do that. And if we do, we will stop the medicine immediately.
Yeah.
And you can just make that kind of agreement.
So, and I think that I know this from type 1, but like so much of it is this trial and error. Like we try it, all that trial and error. Is that the same with you in your field? Like
It is, especially in mental health.
So why? Like what? Why can't you just get it right on the first time, Matt?
Okay, right. I'm just the worst. I can't get it right. And that's the trouble with mental health is it's not just your body. There's a mind.
Yeah.
If it was just a cut, I know how to suture that. I can tell you exactly, because it doesn't take mind. Right. It just takes body. Right. Antibiotics, I know what they'll kill. Done. Vaccine, I know what antibodies it'll build, how to prevent in the future. Done. Doesn't take any mind. Mental health has the mind part as well. So I could increase your serotonin, but I can't prove you have a chemical deficiency. So it will likely help your anxiety or your depression, but there's all these other factors too.
Yeah. So journaling, is that the best way to do it? Like what's the best, most successful path on this? I started the meds. I think it's working or it's not working, and this is how. Like,
you want to have a few measures of what would be success.
Okay.
Because I have people that come to me and they come back a month later, 2 months later, like, well, I think it's working. So I ask very direct questions of, are you going to sleep? Are you waking up? Do you get things done during the day? Do you make it to work? Do you care for your kids? Do you get the dishes done? What were you not getting done before that you're getting done now? How do you feel while you're doing it? Because I care about what they're doing and how they feel about it.
Okay.
Because some people can still get a whole lot done and they're massively depressed. Other people feel fine and they're doing nothing.
Yeah. It's a big balance.
I'm just trying to get those two together. Yeah. So often when I'm interviewing people before we do the medicine, I say, okay, if this was amazing, the medicine did everything. It was the best thing you ever took in the world.
Magic. Right?
It was magic. What would your life look like and feel like 6 months from now?
Oh.
They'll tell me, I'd be happier. I'd be nicer to my kids. I'd go to bed on time. I would overeat. I would be a better neighbor. I'd invite, like this, they'll start talking to all these things. So, okay. So the medicine's not a magic pill, but we're going to see where you're at now on those things, and we're going to look later. You can do simple questionnaires. There's a patient health questionnaire with 9 questions. They call it the PHQ-9. Okay. It's a good little measure of how you're doing.
Okay.
There's anxiety measures. There's lots of them. Your doctor may have these. I have them in my office. People can take them on the online portal to track how they're doing over time. So you can track it exactly, because what we track, we do better on.
Yes. Goals and all those things.
Yes. And if you don't, your doctor should ask you about your functioning and your feeling.
Ooh, I like that. Functioning and feeling. And so let's say that you're the first on, it's day 1. Your kid is on meds now for day 1. Will you be able to, will this fix it?
Right. It depends on the med. Okay. Because there are a few that are that fast.
Okay.
Most don't. Most just cause side effects the first day.
Take it.
It's like SSRIs, Prozac, Paxil, Zoloft, Lexapro, all of those, they just cause side effects in the beginning. The good effects are a month down the road. ADHD meds, they work on day 1. Stimulants and alpha agonists, I mean, you don't get the full effect after days and days of taking it and the consistency and the pattern, but you can see an effect the first day on those ones. Most mental health medications, it takes a while.
Okay. That's awesome. Matt, I love doing podcasts with you. It is ridiculous. I could talk for hours, and you're really knowledgeable. It is quite amazing. And I think part of Joyrific, because we've known each other for a really long time
now.
Part of Joyrific is this mental health aspect of not only do it yourself, but also find the experts that can help you along the journey. And I appreciate you being part of us and part of this. And your last thought, be medicated.
Being scared of medication is like being scared of shoes, scared of a car, scared of a stove. It's a tool. Any tool that's really useful and really powerful can be misused and cause big problems. Medication is the same. Any medication that has a real effect has a real side effect. And that's the cost of doing business.
Yeah. Well, and like if someone chucked a shoe at your head. Like,
right. There's misuse. Cool. Right. There's misuse of everything. You can misuse every medication.
Yeah.
In some way. It's a powerful tool.
Yeah. And I want to do one last call out for like, if you're suicidal and mental health, like if you're at extremes, what do you do?
If you're at extremes, you get what's going to keep you safe, at least short term. Because no one knows what will keep them safe long term, but short term, it's you tell your spouse, you tell your parent, you tell your friend, you call the suicide hotline, get someone to help you get through the next 10 minutes, hour, 5 hours. Then if it's long-term suicidality, that's getting into a counselor, getting into a doctor, medication, that sort of thing.
Yeah, just smelling the roses won't fix that.
No, I mean, I love eating healthy and I love exercise and I love relaxation. All those things help. But if you're all the way there, you're probably past the point where your coping skills work and you need someone else to step in.
Thank you, Matt.
Thanks, Jamie.
We will see you next time, and we're going to talk about being bored.
Being bored.
Awesome.
I love it.